Coarctation of the Aorta by Emily Platt, Sarah McVie, and Jennifer Murphy. Coarctation of the aorta is the narrowing of the aorta, the large blood vessel that branches off your heart and delivers oxygen-rich blood to your body. This PowerPoint will give an overlook to the pathophysiology of this congenital heart disease, manifestations, the expected treatments and outcomes, as well as different education that can be taught to the patient. Although the cause is unknown, it can lead to mild to severe narrowing in the aorta. Narrowing of the aortic structure that obstructs the left ventricular output, increasing afterload to the left ventricle. Blood supply is decreased in the abdominal organs and the lower periphery. Left ventricular pressure increases. Aortic pressure is high proximal to the constriction and low distal. In neonates with severe coarctation, the afterload may be forced through the arteries. Although the coarctation can occur anywhere on the aorta, it most often appears near the blood vessel, the ductus arteriosus. Due to the coarctation of the aorta, the left ventricle of the heart must work harder to pump blood through the narrowed aorta. This causes the blood pressure to increase in the left ventricle. This will cause the wall of the left ventricle to thicken.
The disease process. The coarctation of the aorta symptoms depends on the severity of the condition. Most people don't have symptoms. However, the condition is more common in males than females. Clinical manifestations. Babies with severe coarctation of the aorta may begin having signs and symptoms shortly after birth. These manifestations include pale skin, irritability, heavy sweating, difficulty breathing, and difficulty feeding. The child is more likely to have coarctation if they have certain heart conditions, such as bicuspid aortic valve, patent ductus arteriosus, aortic valve stenosis, aortic valve regurgitation, mitral valve stenosis, and mitral valve regurgitation. It is also more common in people who have a certain genetic condition, such as Turner syndrome. Disease outcomes. Early presentation in young patients may present in the first week of life with poor feeding, tachycardia, and lethargy, and progress to overt congestive heart failure, CHF, and shock. These patients may appear well prior to discharge, and deterioration coincides with closure of the patent ductus arteriosus. Presentation may be abrupt and acute with ductal closure. Late presentation in patients often present after the neonatal period with hypertension or a murmur. Many patients are asymptomatic except for the incidentally noted hypertension. If left untreated in babies, it could lead to heart failure or death. With less severe cases, signs and symptoms after infancy could include high blood pressure, headache, muscle weakness, leg cramps or cold feet, nosebleeds, and chest pain. Expectation and patient education. If your coarctation of the aorta was treated when you were young, you have a risk of the aorta re-narrowing over time. You also have a higher risk of developing high blood pressure. You will need lifelong follow-up for coarctation of the aorta, and you may require additional treatments. Patients that have gone under surgery for coarctation of the aorta are recommended to have a low-fat and low-salt diet, as well as having a total cholesterol to be less than 200. Patients who are waiting to have surgery repair should limit heavy isometric exercises. Educate the patient and family about the needs regarding lifelong follow-up care. Patients should be instructed to have a healthy lifestyle and to avoid smoking and obesity, while also getting plenty of exercise and to control blood pressure.
Treatments. Coarctation repair should occur as early as possible. However, the optimal timing of this intervention is still not clear, as it is a balance between the risk for early and late mortality, reoperation, and long-term effects of hypertension. Treatment options depends on the age of the diagnosis and the severity of the condition. Treatments can consist of surgery, balloon angioplasty, and stenting. A consultation is given and the doctor will determine the best approach based upon your diagnosis. Medication management isn't used to repair the aorta, but it is used to control the blood pressure before and after surgery. Diuretics and digoxin are used to improve cardiac output and to open the ductus arteriosus and improve perfusion to the lower body. NCLEX questions. The nurse is assessing an infant who has coarctation of the aorta. Which of the following findings should the nurse expect? Select all that apply. A weak femoral pulses. B, cool skin of lower extremities. C, severe cyanosis. D, clubbing of the fingers. E, heart failure. A is correct. Narrowing of the lumen of the aorta results in the obstruction of the blood flow from the ventricle, resulting in a weak or absent femoral pulses. B is correct. Narrowing of the lumen of the aorta results in the obstruction of the blood flow from the ventricle, resulting in cool skin of the lower extremities. E is correct. Heart failure occurs when the heart is unable to meet the body's demands and the manifestations of coarctation of the aorta. NCLEX question number 2. The nurse is caring for an infant with congenital heart disease, which, if noted in the infant, should alert the nurse to the early development of heart failure. A, paleness in the skin. B, strong sucking reflex. C, diaphoresis during feeding. D, slow and shallow breathing. It is C, diaphoresis during feeding. The early symptoms of heart failure include tachypnea, poor feeding, and diaphoresis during feeding. Tachycardia would occur during feeding. Paleness of the skin and pallor may be noted in the infant with heart failure, but is not an early symptom of a strong sucking reflex is unrelated to the development of heart failure. And this is references.